So my first question is for all of you. You all come from different areas and from distinct parts of the United States, and yet you are all in the front line in different ways. So could you please tell us what you've seen, what you have experienced during this pandemic? Dr. Blazer, could you start?
Yeah, so this pandemic has been a wild ride. When it hit New York State, and I guess similar to Washington State, it was in the early times of pandemic, and it was when the supplies of PPE weren't great. At the time, I was doing inpatient rheumatology consults, and the hospital was just filling up with COVID patients. And I remember it was just such a surreal experience because those of us who could work from home did. Those of us who needed to be in the hospital were in the hospital, and slowly but surely, every doctor who could lend a hand was converted into a frontline worker. So no matter if you were a specialist, if you were a researcher, medical students got promoted, fellows got promoted, right? And so we were just really all trying to handle this surge of patients. And at the time, in the hospital, I work in a public hospital, so a lot of our patients are Black and brown. And we would go into the hospital, and every day a new portion of the hospital would be converted into a higher level of care. So areas that were not ICU became ICUs. Areas that were outpatient clinic became acute care or inpatient hospital areas. And still, we were just barely keeping a hold on the number of patients. And, the mortality rate was much higher then. Every 10 minutes we were in the hospital, you would hear a code, and that was the sound of someone who was dying of this disease. And it was just so emotional because, I would go into the hospital and take care of these patients and hear all of these codes. And then, we have a morgue at the hospital, and that got overrun. And so we just had these trucks, these white trucks that were like coolant trucks for the excess bodies. And I would walk home because I didn't want to get into anyone's car or subway. So I'd walk from my hospital to Harlem, 4 miles, clear my mind, good exercise, and also prevented me from having to use public transit. And I would walk between the two hospitals, and every day there would be another truck and another truck and another truck. And it was just this grim sign of us losing this battle, and being in a hospital with all these Black and brown patients. Like, these are people who looked like me, and we didn't have enough PPE. And I'm thinking, what if I get this, or would I bring this home to my loved ones, right? It was just a really scary time. And I think it's been one of the most trying times of my medical career, I would say. Watching us come through this, more and more people get it, but also science racing to get this vaccine. And the idea that this could come to an end is extremely, it feels triumphant to me, it feels moving to me. But it has been a very surreal ride, I would say.
Thank you so much. That's the way it sounds, and thanks for that description. That it's like we can see the white tracks, we can hear the sounds, and it must have been very, very, very tough. It's been a tough time. Dr. Hussain, what would you like to share with us today?
Yeah, I would say, as I mentioned, I was not doing as much clinical work this year, but as a research fellow, we as Washington State were the first people to kind of have an actual case of COVID in the US. And I think that was, honestly, it was crazy. Like, as soon as that was detected and found out, everyone was in this like warp speed, communicating with each other, all the hospitals kind of trying to figure out what to do. And from the behind the scenes aspect, I worked a lot with infection control, which basically is when you're in the hospital, the people who kind of decide what PPE you need to wear, what protection you need to have, how we're going to isolate patients, who we're testing, so forth and so on. And that was not something I had ever done before, but because there was so many people who needed to be in the hospital and they needed backup to hold these pagers. I mean, we created this system where any COVID question in the area basically came through an infectious disease doctor. And so we were carrying the pager 24/7 for the first 4 months straight. And it was primarily 1 or 2 people. And so then eventually we kind of all had to get on board and just figure out how to respond and how to do these things. And so from that perspective, it was extremely stressful, not just seeing the patients, but dealing with colleagues who were trying to work, trying to do like their surgeries, trying to figure out the best way to go about seeing their patients in the safest manner, and just really having to kind of deal with that burden and feeling personally responsible kind of for people's safety, right? Like if you decide that this person doesn't need to wear a mask and they get sick, then suddenly is that on you? And I think that was just such an interesting experience coming from that perspective. I think in the same time, it kind of showed me at least, like how quickly the medical community can come together and really share resources in a time of need. We were communicating with hospitals that we don't always talk to, discussing what our protocols for safety were and kind of what they should do and what we think everyone else should do, really while we were waiting from kind of national guidance. But because we had the first kind of episode here, we were like, okay, we need to figure this out and we can't just wait. We have to upscale our testing. We have to figure out how to get people screened. We have to expand all of this stuff. And I think that was just something that I had not anticipated to see so early in my career. And honestly, in a way, it was also humbling, right? For people who've practiced for so long, for all the work and all the training that we've done in medicine, it is insane to have something kind of pop up seemingly out of nowhere and remind you that no matter how well practiced you are, you're not always ready to handle every single thing. And we really had to remember kind of what we've learned before and how to utilize our knowledge prior into something that was a completely new realm for most of us. And so that was really scary. I mean, like going to work every day and being like, oh, cool, I have no idea what I'm doing. That's great. So that was really like a new feeling and something that we had to get over as a team and as people. And I think just I did end up seeing a couple of patients in the hospital in those early days. And it was wild seeing them not be able to communicate with their family members, honestly, not even really communicate with us. As a specialist, I don't always have to do a physical exam, and we were trying to protect that type of contact. So we would see the patients, and then other days we would come watch them through the window or talk to them through the phone or some video interface. And it was just a different feeling, and you felt almost not disconnected at all, but just like you couldn't be as present as you wish you were. And I can only imagine how much that affected them and their families. I mean, they don't even like us really that much, but their families, they can't see. And just that burden was like a lot to handle. And I think there was a lot of emotional and mental health anguish kind of with all the people, no matter how used we are to seeing death, as most of us are, it's not something you get comfortable with. So
yeah, sure. And probably that's good, that we don't feel comfortable in face of death. And I think we can all rely on this sense of being scared or not knowing what's going on and not knowing if we're doing the right thing to protect our loved ones, to protect ourselves. Well, especially for you, like being part of the health community. Janina, from the first moment, the hopes were in genes, now in sequencing the genome, like our eyes were on geneticists like you in order to better understand the virus and to try to create this vaccine. What would you share with us about your experience?
Yeah, I mean, so I tell people all the time, when other scientists battle of like, who's better, the cell biologist or the geneticist, or, I always tell people that if you didn't have genetics, you wouldn't have any of those things. But whatever. One of the things that was really exciting from a genetic perspective, and this is directly related to a lot of the work that I do, people always talk about this fear of the vaccine being developed so fast and how did it get a name and all this stuff. This is all due to the genetics. So very early on, I think at the end of January, the sequence of the full SARS-CoV-2 virus was made public. And what I saw was a huge shift. So the first thing everyone did was said, hey, let's see how closely related from a genetic perspective this new virus is to the original SARS virus. And you saw that they were quite closely connected, not close enough that you could use the same vaccines that you had developed for that virus for this one, but close enough that it wouldn't take that much to create one, which is why we saw the creation of this new virus so quickly, because of all the work that was done on the original SARS. One thing that I think from a scientific perspective that I saw, and especially working at Illumina and seeing how our technology, which is sequencing, enabled all of this work to happen, and now is enabling things like tracing, right? For example, we also learned, I think, maybe a couple of months ago that there were people who got infected with 2 different versions of the virus, and we can determine that all by genetic sequencing. From my perspective, in terms of the work that has been done more recently on the scale of the research. So one thing that I saw that I had never seen before, research was already, changing. Like scientists were being able to publish their research in a place called bioRxiv, where it's pretty much like a medium. Anyone can post their scientific findings. It's not peer reviewed. You just want to get it out there. And what you've seen is thousands of publications in the matter of months being published on COVID-19. A lot of research initiatives, especially at my job at Illumina, but also a lot of academic institutions really quickly shifted from whatever they were working on to COVID-19 projects. You've seen grant opportunities. You've just seen a dump of research at a pace you have never seen before. And it's exciting because it shows you that science and this research can move fast. There are also some cautions around it, right? Because like I said, anyone could just publish a paper in bioRxiv and it's not always scientifically reviewed, but we still see a rush in the peer-reviewed scientific journals, and we've seen a huge shift. One thing that we also saw in the midst of all of this was the ugly parts of our healthcare system, right? We saw very quickly, and Dr. Blazer and I very early on predicted that there was going to be a huge health disparity that happened. And when we saw cases progress, we now see medical racism in real time, right? We now, unfortunately, are watching the results of years of systemic racism within our healthcare system, now trickling down to actual death and disproportionate deaths in people, Black and brown patients. And so that has been, very sad, obviously. But like I said, there has been extreme growth in the scientific community. I'm amazed at all the things that have been done. And to be honest with you, I think this research is going to continue on for the next couple of years. And so I do see, a lot of hope as well, and a lot changing in the way that we look at viruses and vaccines.
Yes, and I think there is hope in this whole picture that you have painted for us. As patients were filling up the hospitals, scientists were rushing into trying to find a solution and writing and then doing the research. So it's like both sides are different sides of this process that we were all going through, and we are still going through.